Okay, hello everyone. My name is Jennifer Wilson, and I'm the executive director of Cassie and Friends, and I want to thank everyone for joining us here tonight for our webinar. And just before we get started, a quick reminder that if you would like to listen in French, we do have live interpreters waiting to serve you. So feel free to hit the interpretation button at the bottom of your screen, and that will take you to the French broadcast. And with that, I'm very excited to get us started on a really important topic today that we're excited to delve in. We have an amazing panel, and this session is called Beyond Transition, Easing into Young Adulthood with Rheumatic Disease. And this session tonight is going to cover the ins and outs of not just transferring a main physician or out of a pediatric children's hospital into adult care, but really the full spectrum of what teens face and what kind of challenges they come up against as they make their way into adult life and adult care. Our session today is made possible by Cassie and Friends supporters. So we are a charity. We're the only charity in Canada serving the juvenile arthritis and other childhood rheumatic disease community 100%. And our sponsors and donors, families, and people who choose to donate or be monthly donors make these sessions possible. We also have incredible corporate support from our partners at Nicola Wealth Management, AbbVie, Amgen, and Sobi. And we just want to thank them so much for making this session possible. We have an amazing group today in the atmosphere here on our virtual webinar. And so we really want to encourage everyone, just take a moment. We really like to create the feeling that we are all together, because we really are all together in our journey with rheumatic disease and at Cassie and Friends. So if you have a moment, put your introduction into the chat box. You can share how long your child or you have been diagnosed with a childhood rheumatic disease, and maybe share one or two things that you're either looking forward to or worried about in the path to transition. All of these sessions, these virtual education sessions that we do, have helped build an amazing resource on the Cassie and Friends website called Classroom. And pretty much every stage, age, concern, challenge is covered in this area. So you'll see the newly diagnosed to injection support tips. We have a school toolkit that ranges right from elementary to post-secondary. And today I really want to also call out the support for youth section, because we have some amazing resources around workplace tools for disclosing to employers about your rheumatic disease, as well as ways to connect with other youth and get involved. We also have an online support network that is now has 627 parent members, as well as some youth with rheumatic disease. And this is an amazing resource. So whether you use the chat box or post, you're really going to find a sort of a 24/7 community that, as it says on the screen, really just gets it. So if you are looking to ask a question or share an achievement or a challenge, this is really an amazing place to do it. We screen membership, so you're getting a really safe and secure, supportive community here. Just really briefly before we get started, a few upcoming events at Cassie and Friends. So May 7th is National Child and Youth Mental Health Day, and we actually have a really big announcement that we're very excited to make. So please stay tuned for that. You're going to see some activity on social media following the My Story and You Can't See It hashtags. And it's also Lupus Awareness Month. So Cassie and Friends is a charity for not just kids with juvenile idiopathic arthritis, but all childhood rheumatic diseases, which can include lupus, dermatomyositis, fever syndromes, and more. So we also really want to take a moment in May to shine a spotlight on kids and families impacted by lupus. The Cassie and Friends Future Leader Showcase is on Saturday, May 13th, and this is going to be a really amazing, it's our first Future Leader Showcase. We have 6 youth leaders from across Canada who have spent the past year developing a project that really amplifies our mission to transform kids and families' lives with rheumatic disease. Each of these youth have done a series of workshops They've trained to be youth mentors, and each of them also receive an honorarium for entering and completing the program. So I encourage you to come hear their projects. We will be awarding a top youth leader, and also to look into the program. If you have a teen, this is an amazing opportunity for them to gain some skills, but also start building their peer supportive network that will be with them through transition. And finally, we have Team Cassie and Friends. It says the run is on. The run is really on. We have runs coming up in Halifax, Calgary, Ottawa, Vancouver, London, Edmonton. We just talked with a family today that's starting a run in Saskatchewan, and I believe Winnipeg as well is coming up soon. So you can go to cassieandfriends.ca/run, and everything you see that happens at Cassie and Friends, these runs play a huge part, not only in raising awareness for kids and family, but making all of our events and programs possible. Right after this session, we're having actually a special youth room chat. You can see the information on the screen here. We're putting a link in the chat box. So if you have a youth watching with you today in sort of the older teen category, this is a place where they can go have an amazing, safe, comfortable conversation. It will be led by one of our youth in the Cassie and Friends community. And a really nice way, again, for them to start creating a network, reaching out and meeting other people affected by rheumatic disease. If at any time during the webinar you have a question, you'll see below there's a chat button, but if you want to ask a question, you can submit it in the Q&A box below. We're going to have an amazing Q&A session at the end of the session where all the speakers will be able to answer questions. And really, this is an amazing chance to just delve into any kind of topic that's important to you. And we're really excited to be able to provide that opportunity. So hope you will use it. Okay, so with that, I'm really excited to introduce our first speakers. As you can see, the idea for this session was really to grow into a national transition fair, and we have an amazing group of speakers from right across Canada. Our first speakers that are going to present are Dr. Evelyn Rosenblum and Dr. Natasha Gackel. And Dr. Rosenblum and Dr. Gackel together are really the one of the ultimate ped room, adult room transition teams. They work together at the Women's College Hospital in Toronto, Ontario, where they lead the JIA Transition Clinic. And this is their third year collaborating with Cassie and Friends to provide transition education to youth and families right across Canada. And Dr. Rosenblum and Dr. Gackel will be joined by Dr. Michelle Batish. Dr. Batish is the division head of the pediatric rheumatology unit at McMaster Children's Hospital. Dr. Batish is also a research expert in transition care. And so she actually is a co-chair of the Canadian Rheumatology Association Transition Group. And I'm also very proud to say that she is the chair of the Cassie and Friends Research Committee. So with that, I am very excited to introduce our first three speakers and welcome them to the webinar and invite them to take over the screen.
Thank you, Jen, for that very nice introduction. I'm just going to share our slides. Jen, if you could just confirm that you see our intro slide.
I do. It looks great.
Okay, perfect. So thank you for Cassie and Friends for hosting this transition event. We're really excited to be here again and talk about things that you want to talk about. So we're going to start off with some basics about transition and what that looks like in Canada. And so we really have a few main objectives. So what does transition actually mean? How does it look across Canada? Because it is a little bit different, but also very similar. What current initiatives are we doing to make this transition time period better? And then we're going to talk about the life step around transition and have a Q&A like Jennifer said. And then we're going to close out about talking about what happens after transition. So what is the definition of transition? And there's a couple of definitions of transition, but we like this one. So it's actually a purposeful, planned process where adolescents or teenagers with chronic health conditions move from a child-centric healthcare system to an adult healthcare system. So it applies to many medical conditions, not just within rheumatology. And planning is the key. So what do you need to know during this time period? Well, you need to understand your medical condition, your disease, but you also need to understand how your disease affects other aspects of your life, because not only are you transitioning your medical care from pediatrics to adult, but you're going through lots of other transitions in your life. So you need to know how is my disease going to affect my education, my career, my job prospects? How is it going to affect your mental health? What are the impacts of recreational activities and social activities and relationships? And how does it impact sexuality and your reproductive health as well? So who transitions? So for anywhere from 40 to 70% of children, their disease in rheumatology will persist into adulthood. And so that's why transition is so important, because many patients will still require ongoing care on the adult side. And we need to make sure you guys have the skills to help you transition from a pediatric center to an adult center, because they are different. And there are lots of concerns on all sides. So as the patient or the youth, you might feel like you're not ready. You might be scared to know what it looks like on the adult side. You've probably spent years in a beautiful pediatric hospital or clinic, and you don't know what the adult healthcare system looks like. And you might be feeling like you're being abandoned. Your parents or caregivers equally have concerns. They also feel like they're being abandoned. And a lot of my patients' parents will say that their pediatric provider was like a parent to them as well. They're also frightened that you guys won't be able to stand up for yourselves and be able to advocate for yourselves. And they're worried that they're going to get sidelined by the adult doctor, that they will no longer be involved in your care. There's also concerns on the doctor side. So from the pediatric point of view, it's also hard for them to let go. We don't talk about it very much, but they've followed you for years. They maybe have seen you since you were really, really young and seen you grown up. And so it's hard for them to let go and know that they won't be there. They're worried that you won't make your appointments on the adult side. And they're worried that maybe the preparation wasn't enough, that they didn't help you get the skills you needed to navigate in the adult system. When you come on the adult side, we have our own concerns. We might seem frustrated with why you can't come to appointments, or why does your parent always come with your appointments? Why is your parent taking responsibility for your appointments when you should be? It might appear to us that your parents are overly involved in your health care because we don't understand the journey that you've been through on the pediatric side. And now I'm going to pass it over to Evelyn.
Thank you so much, Natasha. Hi, everyone. So lovely to be here. Yeah, can't wait to continue on with this session. So the next W is where to transition. Next slide, please. So the differences between adult and pediatric clinics, usually adult clinics are a lot busier. There's a lot more volume of sick adults than there are of kids. So usually the volume of the patients that they're seeing is more. They also may not have an entire multidisciplinary team. So often it's the doc and the admin, and that's all that you see for the visit. Whereas in the pediatric setting, usually there's a nurse, a social worker, physiotherapist, etc. Another big difference is that most joint injections are actually performed in clinic. So often if you've had JIA from the time that you were young, We usually sedate you and do the joint injections that way, but here they're all done at the same time in clinic. Lastly, diagnostic imaging of joints may be different. In the pediatric setting, some of you may have gotten full body MRIs. That's not a common practice in adults rheumatology. So certain things may be different. Not that you get less good care, it's just a different way of practicing. Next slide. So when does the transition of care happen? Next slide. Transition is a process, not an event, and it's very important to remember that transition should actually start, the process should be very early in life. So we should start letting patients know that the transition planning, that they will be transitioning even as early as the ages of between 12 and 14, and bringing it up annually to make sure that they understand that this is happening. In addition, it was interesting, the last webinar that we did about a year and a half ago, I learned that actually, even if you're diagnosed later on in the JIA spectrum, so if you're diagnosed even 15 or 16, it's still very hard to let go of the team who diagnosed you and treated you, even if it's not as many years as from when you were 2. But nonetheless, you know, as soon as it's comfortable and safe and you have your patient in a good you know, and they're in a good treatment algorithm with you and you have a good trust, it's really important to let them know you will be transitioning and start preparing them. Next slide. So, the transition goals. So essentially we want you to develop the skills. So that's part of it. First of all is realizing you're going to go. Second of all is giving you more autonomy. So most of the time, if you are diagnosed very young, your parent has to be your voice and your advocate, but eventually it comes to a point where you become your own advocate as well. So standing up for yourself, really understanding your health condition, knowing what it's called, what your medications are called, really important. Taking charge of your health, making your own appointments, coming to your appointments, and understanding your treatments are all really important. Next slide. What teams need. So they need, like we were saying, knowledge about their conditions, increased self-management skills and independence, and the ability to stand up for themselves. Next slide. So remember that this is a process and not everything needs to be learned all at once. So hopefully in your pediatric centers, they're preparing you slowly for this change. And then in the adult centers, they're very aware that this is a huge change for you as well. So that slowly, you learn your condition over time and you learn how to advocate for yourself. Next slide. Which brings us to the philosophy of transition clinics. Generally, the philosophy should be to provide holistic, coordinated, team-based care as much as they can if your center does have a transition clinic. The goal is to offer personalized care according to your maturity and your developmental stage at the time. So if you are able to make your own appointments and adhere to them, that's great. Then it's a more hands-off approach. If you're struggling with those pieces, then helping guide you through it until you gain that skill. Empowering you for your own self-management skills and assisting family members in their transition from being quarterbacks to coaches. So parents to develop that new role is also a social adjustment. Also, it's really important to promote social adjustments generally and make sure that relationships, education, and vocations, things we'll talk about a little bit later in this evening, are being met. Next slide. So resources to set up with transition clinics. We're very lucky in our transition clinic, and I know at McMaster they have robust multidisciplinary teams as well. But really important for us to have mental health services included in our transition clinic, making sure we know where to send our patients for uveitis screen and TMJ arthritis screening, making sure, depending on which province you're in, that you transition from pediatric primary care to family physician. And even if you didn't have a pediatric primary care that you do now, have a family physician, ensuring your other life transitions are going okay, and connecting with the pediatric providers as well in case to give you confidence and to make sure we know your disease well. Next slide. And so why is it important to transition? Next slide. So it's very important because if the transition process doesn't go well, you're at risk for getting lost to follow-up. The literature does show about 50 to 70, 25 to 50% of patients do get lost during this time. So really important to have a concrete plan. If you're lost to follow-up, you could not have medications, your medications could be interrupted, you could have increased flares, and it's really a concerted effort to get to know your care. So transition is very important to keep you healthy and strong and successful in all you do. And now I will pass it over to Michelle. Thank you very much.
Thank you, Evelyn. So for the next few slides, I wanted to highlight how we as a community are trying to improve the transition process for both our patients, so for the teens, as well as their parents. Next slide. So through the Canadian Rheumatology Association, so this is the association of all both adult and pediatric rheumatologists across Canada, we created a transition working group. And one of our mandates was to put together this position paper titled Optimizing the Transition from Pediatric to Adult Rheumatology Care. We wanted to put together all our thoughts and had input from patients and families about what is missing, what are the barriers to transition, so we can use this to advocate for better resources to make this as best of an experience for you. So we highlighted that there are some definitely challenges that are impacting transition, including, difficulty in accessing rheumatology care depending on where you live in the country, insufficient training and support for transition care. In adult practices, it may be difficult to have a multidisciplinary team, so having a nurse, a physiotherapist, other mental health providers, and then overall looking at health data integration. Next slide. So because of these challenges, we try to provide some solutions to help optimize this transition process. And so they're listed here. Again, the key is to integrate the care between the pediatric and the adult healthcare system. We want to improve the knowledge and skills of the providers who are providing transition care. We try to leverage some of the digital health technologies to help ease that and include some flexibility in all the different models that exist, which I'll highlight soon. Next slide. So there are multiple transition clinics across the country. These are just a few highlighted by multiple arrows you see on the map. And one model is not any better than the next. I think every center, a pediatric rheumatology center, offers a unique approach to transition based on the resources and expertise that they have. Next slide. So depending on where you live, you may experience a different transition approach. And so some of these approaches are highlighted in these figures. So the direct transition approach is where, you've been seen by the pediatric rheumatology clinic, and then at one point in time, you now are being followed in the adult rheumatology clinic. In terms of the progressive transition model, you start with your pediatric clinic, and then there's a combination of clinics, visits that are with the pediatric and adult providers, ultimately ending in just adult rheumatology care. And then the shared care model includes both the adult and pediatric providers working together and following you for a period of time, until which you then move just to have adult care. Next slide. So I'll have Evelyn explain the transition clinic that both she and Natasha run at Women's College Hospital next.
Thank you, Michelle. So in our hospital, we have a shared care model. Our model is very similar to the model that's done in British Columbia and Vancouver, as well as in Europe and London. And essentially, we have myself as the pediatric rheumatologist, Dr. Gockel as the adult rheumatologist, and an advanced care therapist. And we all discuss the patient together prior to seeing them. And then usually we all see the new patient, and otherwise we sort of divide and conquer the other patients coming in and out of the rooms as needed if we need to see a certain physical finding or if we have a more complicated issue. Otherwise, we finish up with the patient and then all discuss the condition and the patient afterwards. And we find this model nice because we all bring a different expertise to the table. So we all get to share and participate in the care of the patients. We also focus in on non-medical areas. So we make sure that we ask about education and vocation in every meeting, as well as mental health. And we ensure that there's the other transitions provided. So family doctor, any jaw issues, ophthalmology, et cetera, as mentioned before. And Dr. Gockel, anything else to add?
No, I would also say that this is like a joint collaboration between multiple organizations. So not just Women's College, but Sick Kids and the Arthritis Society of Canada, which provides the advanced physiotherapist for the clinic.
Thank you. Back to you, Dr. Avatish.
Thanks, Evelyn. So at McMaster Children's Hospital in Hamilton, we run a similar multidisciplinary transition clinic, and multidisciplinary meaning we have multiple healthcare providers, including a rheumatology nurse, both our pediatric and the adult rheumatologist. We are also fortunate to have an advanced practice physiotherapist, as well as a child life specialist. And we identify our patients as young as 14 and start to book some of their follow-up clinics in our transition clinics. And throughout the several years that follow, some of these appointments occur here, and it allows them to get to know the adult rheumatologist, and then the adult rheumatologist gets to know them as well. And throughout these appointments, in addition to addressing any of their medical issues related to their underlying condition, our child life specialist is able to meet with them and discuss transition readiness and goal setting so that they can slowly work on some of these self-management skills that are necessary to make transition a success. Next slide. So one of the tools that we use is an app that's called My Transition, and there's a QR code if you feel like you want to just scan that now. It is a free app that was developed at McMaster, but there are multiple tools that are available. And what this tool allows you to do is to create your health summary. You can include a list of your healthcare providers and their contact information. And the essential piece here is the transition queue. And this is a very short questionnaire that we ask all our patients to answer in our transition clinics about some of their self-management skills. So I've just snapped a few here. So question 1 is about being able to answer a doctor or nurse's questions. Meanwhile, question 8 asks about speaking to the doctor instead of having my parents speak for me. And so based on the responses of these questions, we work together with the patient and the parent to help them achieve these goals over the course of several years, so that hopefully as they get close to 18 and they do then leave us and move on to adult care, that they have achieved as many self-management skills. We also know, though, that transition just doesn't end once you turn 18. And so these skills can continue to be attained after they leave our clinics. Next slide. So what about the parents? We talk a lot about helping the youth and preparing our teens to transition, but we also realize that parents are transitioning too, and it is a challenge for you parents as well. So we have a reference guide for parents that we provide to them that helps them understand the concepts of transition, what they can do as parents to help support their teens through this process, as well as explaining some of those differences that Natasha and Evelyn talked about between pediatric and adult care. Next slide. A new thing that we are studying right now at McMaster, it's actually a study that is being done in combination with the teams in London as well, is examining the role of a transition coach. And so our advanced care practitioner is serving as a transition coach and meets with these teams throughout the transition and after they leave us and are in adult care, to address all the different self-management issues they may have and the non-medical things that they may have about navigating university or their job, relationships, etc. So hopefully we'll have some positive results to help promote this role across the country. Next slide. So we'll talk next about all that stuff around transition. So we focused a lot about the medical side, but there's of course many other things that are going on in your lives at around this time. So I believe we will switch our slide deck and have Dr. Andrea Wallace speak next.
Amazing. Thank you. Well, Andrea, Dr. Wallace gets her slides set up. I'm just going to take a moment to thank Dr. Rosenblum, Dr. Gackel, and Dr. Batish for sharing that amazing overview of transition practices across Canada, and to lead us into the life stuff, as Dr. Batish called it. I'm really excited to introduce two more speakers. So the first is Andrea Wallace. She is an adolescent medicine pediatrician at BC Children's Hospital, where she works in the adolescent health clinic. She also supports a provincial eating disorder program and is the division lead for transition to adult health. Dr. Wallace has a special interest in supporting youth with chronic illness, and this is actually her first time being a part of a virtual education session with Cassie and friends, so we welcome her. And our second speaker who's joining Dr. Wallace is a youth speaker. Her name is Trish Peters, and she's actually joining us from the Netherlands tonight. It is very early in the morning or late at night there. And we really thank Trish. We have literally watched Trish grown up before our eyes. She is an amazing advocate for youth with rheumatic disease and also an inspiring leader in the Cassie and Friends community. She recently completed her bachelor's degree in commerce, and she is now in the Netherlands, as I mentioned, doing a master's degree. So we are very excited to welcome Dr. Wallace and Trish Peters to begin their presentation. Thanks so much.
Awesome. Thank you so much, Jen, for that intro. I just want to make sure everyone can see my slides.
I sure can.
Perfect. Thank you. All right. So as Jen mentioned, I'm going to be chatting about kind of the general life aspects of transition, which is something that I support teens with a lot. So that's a big part of my job. So I'm really excited to be here chatting with you about that today. Because we know that transition is more than just the medical transition. We know that teenagers, when they're going through the transition to adulthood, it's not just their healthcare that's changing. You might be getting your first job, you might be going off to university, you might be moving out of your parents' house for the first time. And these aspects of your life are obviously really personal and unique to each individual person. And so because of that, I really don't want to give you too much in the way of specific advice, because if I get too specific, I risk sort of not being relevant to all of you. So what I really want to emphasize is that I want to give you some kind of tools in your toolkit, some food for thought, things to consider, to really give you the tools you need to be your own advocate and to advocate for what's important to you and your life beyond your healthcare, because really your doctors are there for you to be a source of information, to be a safe and confidential space to ask questions, not only about your health condition and treatments, but also about how your health condition or medications will impact all of those other areas of your life as you transition into adulthood. So really my goal for you today is for you to leave with some ideas about what you would like your ideal transition to look like, and to really be able to advocate for yourself, to talk to your doctors about how to make that happen. So the first area I want to talk about is kind of life after high school, whether that's jobs or post-secondary education, things to think about in that area. might include your healthcare. So particularly if you're going off to university in a different province or a different country, you might need a new health card so that you can get healthcare coverage, medication coverage, even if you're staying within the same province, but you're under your parents' insurance. That might change once you turn 18 or once you graduate. So to look into asking your team or calling your parents' insurance company, looking into those types of things. As Dr. Rosenblum and Dr. Natasha talked about already, like finding a new specialist, and your team can help you with that. If you're going outside the province or outside the country, you might need to find a new family doctor. And then the last thing I mentioned here is documents, because unfortunately, I wish we had a magical all-encompassing health record that we all had access to no matter where you live, but unfortunately, that's not the case. So your healthcare documents aren't automatically transferred to wherever you're going. So it's important to talk to your team about how to get those documents transferred from your old team to your new team. And then another way to think about it is thinking about, you know, how will your condition impact your participation in school or work? So some people might need specific accommodations. So it's important to talk to your doctor about getting a letter to provide to school to specify what accommodations you might need. Most universities have what's called an accessibility office that have people whose job is specifically to manage that. So the sooner you can start reaching out to those people, the better. So I'm gonna hand it over to Trish so she can share a little bit about her experience on what the transition to post-secondary and life after high school was like for her.
Yeah, for sure. So as Jennifer mentioned, I just finished my bachelor's last April, and now I'm currently in Europe doing my second master's degree. So I've kind of had the opportunity I went straight from high school and I stayed home for my bachelor's, but then I had the chance to move out of, like, go away for school within my province and then go away for school again outside of the country and the continent. So in my experience, I found that it was quite tough when I was trying to figure out how to still be with my rheumatologist when I was at home. In the sense that when I finally moved out and was ready to go away, I was really I really had to have those hard conversations with my rheumatologist before I left and kind of really analyze where I was at with my own arthritis. On that note, also right before I graduated high school, when I was unsure, because I think I saw this in the Q&A, when I was really unsure about what university I was going to, whether I was going to stay at home or go away, I had those conversations with my rheumatologist up front, and we had kind of figured out our kind of plan of action, regardless of whether I went away or whether I stayed at home. And I think that's a really important conversation to have even before you pick your university, because I think it does play into the university you pick, because it is one more thing you have to think about. And as like life after high school, it does change quite drastically. So it's always something that does need to be at the forefront of your mind. I moved continents, and that was something that, you know, I'm very lucky that I was able to do, and go to school here and have access to health resources in the Netherlands. But I also chose a country in which I knew I could easily have access to healthcare at a decently cheaper price if I really, really needed to. I do have health insurance, but even without health insurance. So I know that that is also something that we have to think about. And I think that's really all I can think about right now. Dr. Wallace, do you have anything that you think I should add?
No, I think that that's awesome. So maybe we can move to the next topic for now, and then if folks have any questions, we can chat about them in the Q&A later. All right, so the next topic we wanted to speak about was drugs and alcohol. And I think this is a really important topic to talk about for teenagers, because we know that experimenting with drugs and alcohol is a very common experience in adolescents and young adults. However, just because it's common and very normalized in our culture doesn't necessarily mean that it's safe, especially for somebody with a chronic illness like arthritis. There are risks to it. However, I know that no matter what I say or your other doctors say, many young people are going to choose to use drugs and alcohol anyway, and I'm not here to judge that decision, and none of your doctors are here to judge that decision. We're just here to help you be as safe and healthy as possible in whatever you choose to do, and making sure that you're informed about the risks. So that's really my goal for you today, is kind of inform you about some of the risks and really encourage you to be open with your doctor about the choices that you're making around drugs and alcohol, because if they don't know the choices that you're making, then they can't help you make them in a safe way. So it's really something that I encourage you to be open with your doctors about if you are choosing to use drugs or alcohol, so that they can help you make the safest choices for you and your health. So a couple of the risks I just wanted to highlight. I could do a whole hour-long presentation on the risks of drugs and alcohol, but I don't have time to do that today. But I just wanted to touch on a couple of risks that are risks for anyone who's using drugs or alcohol. So for example, cannabis can harm brain development and have impacts on mental health. Vaping and smoking can impair lung function, as well as there's specific risks to think about for adolescents with chronic illnesses. So for example, alcohol can interact with some JIA medications such as methotrexate and have negative effects. Smoking, for example, can lower your bone density and increase your risk of osteoporosis, which we know people with JIA are already at higher risk of. So there's lots of different risks to think about, and I really encourage people to, talk to their doctors to get the best information that's specific to your condition and your medications. So my first suggestion is always ask your doctor. If you don't have your doctor available right away, a great resource to go to is this website, which is called drugcocktails.ca. And in general, I really encourage you to try and seek out resources that are published by doctors or hospitals or medical societies, because that information is trustworthy and evidence-based. There's a lot of misinformation out there on social media, so please don't trust Instagram or TikTok for your medical advice. Please ask your doctor or try to find a really trusted medical-based resource online. So for example, this website was created by the team at BC Children's, and the goal of it is to give information about interactions between alcohol and street drugs and prescription medications. So an example is if you look up methotrexate, and it'll show you interactions with alcohol, and so it'll tell you that that's quite a serious potential risk for harm, in that drinking alcohol while taking methotrexate could cause liver damage. And so that's something you might want to avoid until you can talk to your doctor further about it. All right. Trish, anything to add on this topic?
Yeah, I think this is quite an important topic, as you said. I was definitely one of those kids that obviously you want to experiment as a kid, but I can also really, really agree with you need to talk to your doctor regardless of what anyone says. It's really, really hard to say no a lot of the time. And I was lucky that I was raised in a way that it was very easy for me to say no. But I know that a lot of youth experience the fact that they're unable to say no to their peers. And when it comes to that, again, it needs to be at the forefront of your mind that you are a little different and you do need to worry about things that, normal kids don't really have to worry about. Um, that's not to say not to have a good time. I mean, I've certainly had a good time in my teenage years and now as well. But again, it's just about speaking to your doctor and making sure you get the right information and the right resources to make sure that, I think smoking cigarettes, at least, it's not a big worry in Canada. Our smoking culture is very limited. We're quite lucky with that. I think even on university campuses, it's not allowed in all my experience, at least. And I think drinking is a little bit different because a lot of the time, you think it's pretty harmless and we tend to forget that it's still a substance. And so it's really, really important to have that conversation with your doctor. And I've had it with my doctor multiple times. And as you get older and you kind of learn your body, and I know that, like, for example, drinking makes me a little bit more sore and a little bit more flared up the next day, and I know that, so I'm able to control my limits and kind of, you know, realize where I have to stop in order for me to feel okay the next day. And I think it's really important that you continue to have those conversations, not just with your doctor, but just with your parents. Like, I know my parents were so important in the sense of when I was exploring, not just drinking, but weed is a big thing in Canada as well now. But when I was even thinking about taking CBD for pain and for pain management, but I know my parents were key for me to even explore that. And, they did CBD with me at one point just to try it out. And, it didn't work for me, but to be able to have those open discussions with a trusted adult, regardless of whether it's your parents or your doctor, I think that's the most important factor when it comes to drugs and alcohol, because at the end of the day, as a teenager, you think you know everything, but I'm going to tell you that you really don't. And your mom and dad and your doctor usually know more.
That's awesome. Thanks, Trish. And I think I really want to sort of emphasize what you said. It's really important to have these conversations with your doctor, and we'd really encourage you, as Trish said, to be open with your parents as well. However, we also know that not all youth are there yet in terms of their relationship with their parents, that they're ready to talk about those kinds of things. Yeah. So if you're not ready to talk to your parents, but you're wanting to talk to your doctor, remember that your doctors have to be able to have confidential conversations with you. And you can always check in with your doctor and say, hey, can we make sure this conversation is confidential because my parents don't know about this yet? And it's okay. And your doctor should be able to provide that confidential space for you. So if they forget to mention confidentiality to you, it's okay to ask for that. And they'll be able to provide that.
And as much as it sucks, you do have the right to ask your parent to leave the room if you want to have a private conversation. And I know that sometimes that's a little tough to do, but oftentimes it's for the best because you do need to have those conversations.
Yeah. And I think we're working towards a culture as a medical field where we try to normalize asking parents to step out and taking that onus on ourselves as doctors to be the ones to ask the parents to step out, because it is hard to put you in a position as the youth to get your parents out, because then your parents are like, well, what are they going to tell the doctor that they don't want to say in front of me? So as much as possible, we try to take that onus on as doctors. But if we forget, please do ask us, and we're always happy to do that. Awesome. So speaking of topics you might not want to talk about in front of your parents, our next topic is sex and relationships, which is also something that is a big part of the transition to adulthood, and can be impacted by your chronic illness. So some things people might want to talk to their doctors about or start thinking about. Some people find it hard to think about how to tell their romantic or sexual partners about their diagnosis. So that's something that you can talk through with your team if you're not sure if you're comfortable, how to broach that conversation. Another thing is if young people are starting to have sex and are not yet wanting to have children, they might want to go on birth control. And there are certain types of birth control that are contraindicated with certain illnesses, or if you're taking certain medications. So if you're thinking about starting a birth control medication, it's really important to have that conversation with your doctor so that they can help you pick the method that's right for you. And as well, some people, as they transition to adulthood, are thinking about having children and getting pregnant, and might have questions about, is my illness or medications going to affect my fertility or my ability to get pregnant? Are they going to cause complications if I do get pregnant? Or they might have questions about, is my condition genetic, or what are the chances of my child getting this condition if I do have a baby? So those are all questions that you can ask your doctor. And it kind of seems like these might be topics that are not necessarily related to your arthritis or your medical condition. And so it might seem like something that it doesn't come naturally to talk to your doctor about, but these are actually really important conversations to have with your doctor. If you're, in a relationship, if you're thinking about birth control, or if you're thinking about getting pregnant. Any thoughts on this, Trish?
Yeah, so I am 22, so I've had a couple of relationships. I've been lucky enough to be in those, and I've also been on birth control. I actually just got off of it, but I was on birth control for the last 5 years, so quite a long period of time. But I do remember it was actually my pediatric rheumatologist that wrote my prescription for my birth control, and at first it was just to regulate my periods, and of course, then it did become a contraceptive later on. And so again, like, those conversations are very important to have with your doctor, especially knowing the side effects of birth control. It can impact you in a significant way. And so I was very lucky that I was able to find one that I was, relatively happy on. But I do know of horror stories when it comes to birth control. So if you feel a certain way when you're on birth control and you feel like this just doesn't feel right, take it to your doctor. I know as youth with arthritis, sometimes we're just like, we can just suck it up and deal with it. But I know birth control isn't supposed to make you feel like that. So make sure at least you take those up with your doctor. On the other hand, I've also been in 2 long-term relationships, so respectively 3 years and 2 years. And so I've been in situations where, your disease is at the centerfold of your relationship, and you have to have a difficult conversation. I've been lucky enough that I'm quite open about my illness now, and I was diagnosed at 11. So by the time I was 17, 18, I was quite open, and I had Cassie and friends, so I was really able to explain my disease to partners and to kind of help them to understand what I was going through. But it is something that impacts your your relationship, because it is something I've had partners that have had to, help me get dressed when you go on vacation together, or, sometimes you just get up and you can't move, and, things are different, or I have arthritis in my jaw as well, and I've had times where I've woken up in the morning and I've looked at my significant other and I've been like, yeah, like I can't open my mouth, like we're gonna have to go to McDonald's and get a smoothie because I can't eat. And so it's something that you need to have a conversation about. And I'm hesitant to say right off the bat, but personally, I think that it's always better that you are very open about it as soon as you can be and as soon as you're comfortable to be, because if something does happen, they also need to know who to contact or who to get in touch with just in case. And so I know in like my past relationships that I've been able, like my significant others were very close to my parents as well. And so they had contacts in case like something did happen, or I was unable to drive for a change, or I was having a flare up and I couldn't come home, or just things happen. And a lot of the time in a relationship, that person is supposed to be your partner. And so to have that open communication, especially about an illness that can impact your day-to-day life quite um quite strongly, I think it's very important to have an open and honest communication in that sense. And also to like loop your parents into it, right? Like if you're planning on spending the night or you're planning on going on vacation or a longer period of time away, you know, your parents have seen you usually at your lowest and at your highest point in your disease. So, yeah, they know how to take care of you, but to make sure that they know that whatever's going on in between you and your significant other so that they're also able to help if, the need arises.
Yeah, I think you bring up a really good point, Trish, that, being open and sharing about your diagnosis with your partner, as challenging as that can sometimes be, it's not only good for strengthening your relationship, but it can also be kind of a safety issue that if something happens, it's important for them to know how to help you.
Yeah. I mean, I've experienced it in a very in a very kind of traumatic situation, so I know that, like, you need to be able to, like, have that open communication because at the end of the day, like, if you can't move and your significant other doesn't know what's happening, it's also a little bit traumatic for them.
Yeah. Yeah. And again, it kind of seems like something that's not directly related to your medical care, so it might seem like a weird question to ask your doctor, but you can actually ask your doctor, like, I'm starting a new relationship and I don't really know how to share my diagnosis with my partner. Like, do you have any tips on how to navigate that? And like you and your team can actually talk about that together.
Yeah.
Yeah. And with your parents and any other supports that are important to you in your life.
Yeah.
All right. I think that's it for me and Trish.
All right. Thank you so much, Dr. Wallace. And thank you, Trish. That was actually, you know what? That was an incredible conversation. And I'm going to remind everyone, it's also 2 a.m. in the morning for Trish. And Trish, like, I just want to say, like, all of these things should be out in the open, but we all know in practice, they're not. They're hard to talk about. There's a lot of sensitivities between healthcare and parents and youth, and we all want to be where that conversation just was, but you led that bravely and just with so much transparency and maturity. So I just want to say thank you so much. And Dr. Wallace, adolescent medicine specialist plays such an important role in bridging a really special patient population that I feel too often gets grouped in with adults, and they're not adults. They're emerging adults. And so I just think this was a really special discussion. And at this stage, I'm excited to bring back all of our panelists to open up to a Q&A and encourage everyone to who's listening and who's here tonight to become a part of this conversation. And whether you want to ask a question or let everyone know sort of where you and your child are in the transition stage. This is sort of your opportunity. Actually, I think before we do Q&A, Dr. Rosenblum and Dr. Geckel, did you have some last words from the Women's College Hospital?
Yeah, did you want us to do our closing slides now?
Yes.
Okay, perfect. Okay, so give us 1 second here.
And it'll be Dr. Geckel and Dr. Batish for the last few.
Oh, right.
All right, so, and Jen, sorry, can you see?
Yeah, you are, well, it's loading. Yes, you're totally on now. Thank you.
Perfect. So a lot of the time, this question comes up later, but a lot of people ask, well, what happens after I transition? And so first of all, we want to emphasize you are not being kicked out. Really see this as graduation and graduation in developing the skills you need. And so I found this slide really funny and interesting. Evelyn actually found this slide a couple of weeks ago for another talk we did. And so as you move through young adulthood is, remember, you don't need to figure everything out. And so this was a study where they asked people, when do you feel like you have reached adulthood, or do you feel like you have reached adulthood? And if you look at the graph, we feel like we become adults when we hit our late 30s and 40s. So it's kind of crazy that we think that at 18, all of a sudden you become an adult, or even at 21, 22. So don't worry, you don't need to have everything figured out. So what are some specific goals? So you need to learn how to navigate the system, and the adult system is a bit more complicated, a bit larger, and a bit more disjointed. But what I tell people is you also need to know who and how to reach out when you don't know how to navigate the system. You need to know your disease and your medications. But once again, you need to know how and who to reach out to when you don't. So if you need to know something about your medications and your diseases, that's when you should reach out to your doctor. And have a plan for flares, for vacations, for illness. What are you going to do if you flare on a Saturday night and you don't want to go to Emerge? In fact, you probably want to avoid going to the Emerge these days. What are you going to do if you flare on vacation, or if you have an injectable medication? Do you know how to travel with it? Do you know what to do with your medication when you get sick? And similarly, you need to know how and who to reach out to when you don't know these answers. And so the point with this is that you don't need to have everything figured out. I would say a lot of my much older adult patients don't know the answer to a lot of these questions, but emphasizing that, hey, you need to be able to reach, who do you reach out to get these answers? And remembering that your parent or your caregiver can still be a support person. Oh, sorry. Can still be a support person. They're not going to be the main person, but they can definitely be your ally, making sure you get to where you need to get to. Now I'm going to pass it over to Michelle.
Thank you, Natasha. So just to summarize what we've discussed in the past hour, so we went through what really is the definition of transition. And the key here is it's a process. So it's not just you turn 18, you move to adult care, and that's it. We have to start early, 14 even is an ideal time to just start thinking about what you need to do so that when you do turn 18 and you move on to adult care, you're as prepared as possible. But that transition doesn't just end at 18. You continue to grow and learn about your disease and how you manage it well into your 20s. There are multiple variations of transition clinics that exist, and we are fortunate across Canada that multiple pediatric rheumatology centers have established transition programs and work very closely with our adult our colleagues. And they all have the same guiding principles. Many initiatives in transition, and it's an exciting time right now with regards to how we're working towards improving transition. Dr. Wallace and Trish did an amazing talk and really talked about all that other stuff, the life things that go on outside of your disease and how you manage juggling both of those things during the transition period. And then what do you do after transition, and how do you continue to develop those life skills to continue to self-manage your disease? So just as a last closing slide, I wanted to plug a survey that our group in McMaster is conducting right now. It's an anonymous survey. Feel free to scan the QR code for some more information. But as just discussed, you know, if you are a patient on methotrexate, you need to know, you know, can I drink? How, you know, how much is safe? What does methotrexate do to my liver? You know, what about my reproductive health if I'm on methotrexate? So we want to better understand what your level of knowledge is around it so we can do a better job at educating you about this. So feel free to scan that QR code for more information. Thank you. And I think now we take it back to Jennifer.
Thank you, Dr. Batish. And I know we are going to send out that survey or include it in our post session email. So stay tuned for that as well, and really encourage everyone to participate because that is how we learn. Thank you so much. Everyone is back on camera, and we have some questions to go through. So I'm just going to get right into it. One of the questions that came up was around insurance. And I know we don't have a panel of insurance experts here, but from experience, and maybe Dr. Batish, you're the biggest on my screen right now because I think you talked last. So how have you helped families navigate this? The question was, you know, when a child is 18, are they still covered under the parents if they're a full-time student? And even where do you direct people for resources?
It's a great question, and there's no one easy answer. I think it depends on the insurance provider that your parents are under. So it's important to get to know the policy that they have and understand, you know, is there an age cutoff? So it could be 18, but in some cases it could be 23 or 25, assuming you're still pursuing post-secondary education. So I think it depends on the policy that your parents have. So it's important to kind of educate yourself on that. But again, those are great questions that you should bring up during your transition appointments because we can help guide you to better understand. And we try to also bring those up as well to our patients during our transition clinics so that you can then pursue that information yourself so that maybe at the next appointment, you better understand, okay, well, do we need to make changes to the insurance, you know, forms that we need and so on, just to ensure that we don't go through a period where you may not have access to your medications.
I saw a lot of head nodding from Dr. Wallace. Did you have anything to add?
No, I think I would echo the same thing as Dr. Batish, really like looking into your parents' insurance policy, and if needed, there's usually a contact person from the insurance company you can call to clarify if you have questions about that policy. Because like she said, every policy is different. So it's hard to give kind of general advice other than look into what yours is and talk to your team about it.
And I was actually on a call with another youth in our community today who was telling me all about their excited plans of going to Europe. And I said, oh, I'll give you, maybe connect you with Trish because she had lots of questions. And I think that's a cool part of Cassie and Friends is being able to connect and like, how did you do it? But Trish, did you navigate any special insurance while you were in the Netherlands or are in the Netherlands?
Yeah, so luckily I'm covered under my mom's insurance until I'm 25, as long as I'm in post-secondary, which is for the foreseeable future where I am going to be. So luckily I still have access to therapists and things back home that I'm still, you know, working with, at least on the mental health side. But when it comes to the rheumatology side, it's a little bit more difficult. I think I have student insurance here, and so it's a little bit of a pain because I live in quite a small town in the Netherlands, so there's no rheumatologist here. and I'd have to go to Amsterdam to get access to one. But having access to all of your blood work and your paperwork for that, it's actually quite easy, at least here, to get your blood work done. Like your doctor literally gives you a sheet of paper and asks you to fill it out if you have a rheumatologist, and they kind of know your steps in that case. I think it's also a little bit more affordable to just go to the doctor. Like it cost me about 30 euros if I really needed to go without insurance. So like you really have to do your own research into what you need. Luckily I've been in remission. I don't like know if I think I will have to see a rheumatologist at some point when I'm here, but for now, for the last 4 months, I've been okay. But again, like it really means like you just have to do your own research, especially when moving out of the continent, because student insurances are very particular. And a lot of the time, if you have an illness already, they are a little bit more hesitant. So to, to do that your own research in that case. And a lot of schools have accessibility offices. Those are very helpful, especially like I'm doing a double master's through Queen's University back home. And so their accessibility office actually was able to help me get in touch with the Maastricht University accessibility office. So a lot of the time they're interconnected. So just to like ask those questions, and sometimes it feels like you're bothering them, but you're not. Just keep asking until you find an answer.
Great, thank you, Trish. We had a couple questions that followed up on, we had a pretty good discussion about alcohol usage and other substance use. And some of the information I think was already shared in terms of impacts and all of that. But I think both of the questions that are around sort of like a teen and maturing and, wanting to, I guess, help them through that in a safe and effective way really comes down to, I think, communication and how maybe Dr. Rosenblum, how does that communication really happen in clinic? So how does a teen, maybe we role play, but how does a teen even ask their parents to leave the room?
That's a great question. Thank you so much. And in this day and age too, we have to think about it two ways. One would be in clinic in person, and the second would be virtual care as well. And the virtual piece is actually the hardest part because we don't actually know if the parents caring ear is lurking somewhere close enough, or if it's truly quiet in the room, or if a roommate, if they're in a dorm and they don't want to share, all of those things. So anyhow, as in pediatrics, we're very much trained by our adolescent medicine colleagues going through to have the space and to give the patients autonomy so that they can actually talk with us separately. In the adult world, it's different because usually the patients are, and Natasha could speak to this, but the patients are coming in and often they do have caregivers or children that they bring. It's almost the reverse when you're at the other end of the spectrum. So in any case, I think advocacy for everyone. So again, this is the theme that Trish was talking about, and I'll let her speak in a bit, but empowering the patient to say, you know what, I need some time alone with my doctor, but also educating the doctors to try to facilitate that and say, hey, I need some time alone with my patient too, to make sure that they can answer. And virtually speaking as well, I always check with the patient to see where the parent is. And you can kind of really tell now that we've been in this environment for a while if they truly are alone, and I tailor my questions accordingly.
Dr. Gackel, do you have anything to add and maybe even just share how you sort of encourage open communication with your appointments?
Yeah, I think the approach that I've taken is just every single young adult I boot the parent out of the room. So I take the initiative because I know it might be difficult for them to ask their parent or caregiver. So a lot of the time they have nothing else that they want to say privately, and sometimes they do, but I've kind of just built it into my practice that that at some point during the appointment, I just kind of turn to the parent and say, I'm just gonna get you to step out for a few minutes. I'll call you back in when we're ready. And that's kind of how I've gotten around it, because I know it can be difficult for a child to ask their parents to leave the room. So I kind of say, you know what, I'm going to take the hit for that. I'm going to be, for lack of a better word, the bad guy and ask you to leave the room. So I kind of just build it in to kind of get everyone. I do it myself a lot of the time because I find that it just doesn't come up otherwise.
Amazing. And Trish, I've met your lovely parents and had just a good laugh and reflection about, and just, it's amazing the stories you shared and how you've had that open line of communication. And I know that, that you've also worked in the Cassie Friends community and met other youth. And, what is your advice to youth who maybe don't feel as comfortable talking to their parents or to just start even having those kind of conversations?
Yeah, I mean, I think I was about 14, 15 when my mom started leaving my appointments. But that was still a hard conversation even for her and I to have, and we have quite an open relationship. Because at the end of the day, she is your mom, or my dad and I are also quite close, but he wasn't there for my appointments. But, at the end of the day, they're still your parents. And so they do want to protect you in their own way. A lot of the time, I know my doctor also kind of took this approach in the sense that when you're an adult and going to adult care, your parents aren't there with you. Usually, adult rheumatologists don't care if they're in the room. They don't really necessarily want them in the room. So I think the approach that I took on it was more so in the sense that I needed to be prepared to be an adult in adult care. And, to this day, I don't feel like an adult, but to be in those rooms and to be able to talk about my disease in the sense where I'm not looking at my mom every 5 minutes or every 5 seconds, you have to build that skill early on. And a lot of the time, if you can explain it to your parents in that sense without kind of broaching heavier topics, they usually understand in the sense that you need it to be independent and to learn how to handle your disease on your by yourself. And so I think that's a way to get around making them feel a little bit bad about the fact that you would like to talk to your doctor on your own.
Thank you. Our next question is how you set up your team for success when taking medications long term. And I have two. I'm going to first send this to Dr. Patish and then to you, Dr. Wallace. So Dr. Patish, I think what I'm curious about in this question is, how do you encourage or test kids or have a discussion? Do you know if the kids know what medications they're on?
Yeah, I think it's very important that we discuss medication adherence with our patients and to normalize that, it's okay if you miss your dose, here or there. It's, we're human beings and sometimes life gets busy and you forget, and that's okay. So we have to kind of, remove that judgment, because I feel like a lot of patients, will feel that their doctors or nurses are going to judge them and feel less of them if they've, missed a dose or forget their pills. So just to remove that and normalize it, that it's okay. And then just have an open discussion about what are the barriers that they're facing. Is it that they're just truly forgetting because, they need 3 doses a day and that middle dose during school is just impossible to take? And so if you can sort out what the barriers are to them being able to take their medications regularly, then we work through the solutions. If it's, I keep forgetting in the morning because I'm always rushed and late, well, could we maybe shift the time of the medication? Can we set alarms on your phone to help remind you to take your medication? If it's because of a side effect, then how do we improve that? How do we lessen those side effects for you? So I think it's really important. And then I think the other key is that we face a lot is, well, you know what, I'm fine today. Why do I need to take my pills? Because I feel okay. So making them realize that, this is a preventative medication, for example. We're trying to prevent flare-ups from happening. So sometimes we, teenagers just think in the moment, I'm fine today, I don't need to take it. They don't think, well, in 6 months, I'm going to flare. So having an open conversation and really getting to the bottom of what is it that's preventing them from being able to take their meds on time, and then working out the solutions.
And Dr. Wallace, thank you. As a pediatric medicine specialist, like what are the skills, or what is the process of like having the medication out with breakfast in the morning to living on your own or being out at university? And of course, whether it be oral medication or having to self-inject, and even just, remembering, ordering, picking up at the pharmacy.
Yeah, definitely. Those are all like super important skills to develop. And I think there's different situations like Dr. Batish was talking about. Sometimes, teenagers struggle to take their medications. I see also a lot of situations where teenagers are taking their medications, but only when their parent is there to tell them to. And so it's sort of working on within that transition to adulthood. You're gonna be in a situation where you've moved out to university, you're living on your own, and your parent's not there to remind you. How can you remind yourself? And if you can't remember it on your own, we talk about using different tools, setting reminders or alarms on your phone. As you said, like leaving it out on the breakfast table, or leaving it on your sink beside your toothbrush so that it's there every morning when you go to brush your teeth. Making it a part of your normal routine is super important, because if it's something that's sort of outside your normal routine and you have to remember it or take an extra step to do it, we're all human beings, we're lazy, we don't want to take that extra step. So the easier we can make it, the more likely it is to actually get done.
Great, thank you. I know we're getting close to time. We had a couple questions about university life. And so one of the questions was just getting connected to university life if you happen to be taking online classes. And I think, Trish, you could probably speak to that. And the other was around university accommodations and access to those. So maybe Trish, if you wanted to get started, and then if anyone else had any information to weigh in on university accommodations and how to access, that would be great.
Yeah, for sure. So to get involved in university life, especially when you're online, I think, of course, it is a little bit difficult. Like everything got a little bit harder during COVID, I think. I did the majority of my bachelor's on a computer at my house. And so that's always a little bit tough. But on the other hand, I think universities are making it a little bit easier to join events online, and they're out there. Like you do have to go looking for them a little bit. Your student union is usually the first place to go looking. A lot of universities have their student unions on Instagram and other social medias. And so finding events through there and coffee chats, and even, well, I'm a business student, so maybe I'm a little bit biased in this sense, but LinkedIn is also a great place to be if, to find people that do go to your university. A lot of kids in their bachelor's and their master's are on LinkedIn because they're looking for jobs. But I've made a couple of friends on there. It's not that hard. Like a lot of the time you type your university and then you can find people. So like my advice would definitely be look for your student union, look for clubs on Instagram. If you search up your university name, a lot of things will pop up. A lot of clubs that are, I think, currently are in the hiring time frame. So if you're going to university right now, or you're starting in September, a lot of clubs are hiring right now. So take a look at that. On the accommodations and accessibility standpoint, every university is different. Sometimes they transfer over, sometimes they don't. Sometimes your program managers are able to help, sometimes they aren't. It really depends on, like, for my master's program, it was very niche at Queen's, so we had a program staff of 4 people who did all my paperwork for me, which was amazing. But in my bachelor's program, there was a lot more students, so they didn't really care. But for me, at least, it transferred over every year. Some universities, you have to refile your paperwork every year. So just to like keep track of that, usually you'll get an accessibility coordinator or like an advisor. So they're usually the ones that you go to right away. They tend to be on top of things. Sometimes they forget about you, but you have to remind them that you exist. Uh, and honestly, just to use your email, like they're on their emails 24/7 and during all work hours. So if you send them an email and you don't get a response within 24 hours, I would send them a follow-up just because they do have a lot of students on their plate. And even in that sense, there's also so many other mental health resources at schools. I know Queens also had its own free clinic. If I really needed to go to the doctor, I was able to go to the clinic at Queens. So I know a lot of universities have that. So just to know what your resources are in case anything happens, aside from your accessibility advisor, of course. Yeah.
Did anyone else want to weigh in on that question?
I just wanted to say also, don't be afraid to come to us, whether it's the pediatric or adult rheumatologist or pediatrician, family doctor, ad med physician, if you need help advocating, because in some places they may just give you a quick no and that's it. But if we write letters kind of advocating exactly what needs you have, it can definitely help as well.
Great. I also just want to plug too, if anyone is going to the University of Alberta or the University of Toronto, 2 youth in our community have started at the University of Alberta. It's called Rheumers, and it's actually a registered student club with a mandate of raising awareness of rheumatic diseases in students. And at the University of Toronto, it's got a longer name, but it's the Juvenile Arthritis and Rheumatic Disease Action Club. And I know that it just got started by a young patient called Kira this year and is already very active. So really do look at what groups are available, because that's something that we hope to spread, and not just at university, but whether it be colleges or in workplaces. Some HR departments have excellent social and health and wellness committees, and just to connect and find peer support. And that Cassie and Friends is also here to help youth and parents find that support as well. And with that, I know we're at 6 o'clock, so I just want to thank you everyone so much again for your time tonight. Trish, thank you so much again for being so transparent and sharing your personal story so bravely. And thank you to Dr. Rosenblum and Dr. Gackel and Dr. Batish for such an amazing overview of transition and the landscape of cross Canada, as well as the areas that we're working together to improve transition services. And Dr. Wallace, thank you so much for being here to tackle the life stuff and to talk about some of the topics that are just so critical to youth development and adult lives. And it's been amazing to get these issues out in the open today. And I hope that everyone who is watching got what they needed. But if not, I encourage you to reach out to us at info@cassieandfriends.ca. We are so happy to answer any follow-up questions if we didn't get to them tonight. Well, there we go. I was just trying to share my screen one more time. So thank you again to our speakers. We will be sending out a survey right after this session. So please do let us know if there was anything missing, what you liked, what we could do better. And just a reminder, the youth and young adults who are online tonight or who would like to join us, we have a youth room chat happening right now. So there is a registration link in the chat box and you can join live and stay for as long as you like, listen or share. Finally, please do visit cassieandfriends.ca. We have a ton of resources specifically tailored to the pediatric rheumatic disease community. And whether you're in Canada, or I saw one of our attendees saying hello from Brazil, there's a ton of information on there and lots of ways to connect. Finally, if we would really like to keep doing these virtual education sessions and grow our program. So we appreciate any and all support. Of course, that could be financial, like a donation, but also getting involved. So with that, thank you again to everyone. And I hope everyone has a really great night.